Good morning and welcome to Between the Trees, presented by the Woodlands Online, a broadcast of the Woodlands Area Chamber of Commerce. We are appreciative that you would join us here today. We have another very special guest and looking forward to a great time this morning with Dr. Jason Piefer, medical doctor with Piefer Bone and Joint, a Chamber of Commerce signature member, all around great individual, and our guest today. So, Dr. Piefer,
thank you so much for having me.
So,
glad to be here.
We're so glad to have you here and to get to share a little bit of time just talking about you and your practice and your thing, all the things that you all are doing today and have done in the past. So don't want to take up too much time, so I'll just kick it off and say, tell us a little bit about yourself.
Awesome. Well, I'm glad, super excited to be here. This is awesome. I'm pumped to be a part of the Woodlands Chamber of Commerce. That's awesome. I started Texas A&M University. That's right, class of 2001. Graduated from Baylor College of Medicine. Went from Baylor to the University of Alabama at Birmingham, where I did my orthopedic surgery residency. Did a year of sports medicine fellowship in Taos, New Mexico, so got to ski and enjoy some good weather.
Sure.
And then I've been here in the Woodlands, working with the Woodlands Sports Medicine Center for the last 14 years. And then Piefer Bone and Joint, PB&J, we just kind of launched that as a personal brand, some personal marketing to help get me out there into the community a little bit more. So love my group and have loved being a part of PB&J. It's been awesome.
Awesome. Excellent. Well, thank you for sharing that. Let's dig into it a little bit.
Sure.
So, University of A&M.
Yes, absolutely.
So you gigged them. Baylor.
Baylor here in Houston. Yep.
And so you sicked them. So you gigged them, you sicked them. Then you went to Alabama, where they have no idea what we're talking about.
That is correct. Yeah, UAB is the Blazers, so they're Dragons. It's in Birmingham, Alabama. Yeah. Really got fortunate to train with some really, really high quality orthopedic surgeons. James Andrews, who a lot of people know, one of the leaders and thought leaders in orthopedic sports medicine, was there. I got to train with him, got to train with James Stannard, with just amazing, amazing mentors there, and then moved to Taos, New Mexico, where I did my sports medicine fellowship with Jim Lubowitz, Jeb Reed, Dan Gutman, just leaders, thought leaders, and production leaders in orthopedics. So it was
sure.
Really great.
So at the college level, so at UAB, did you specialize in any particular sport, or did you work across several sports?
We worked across the board. So we covered primarily football teams, but when you're covering a football team, just like I cover here, you're covering the entire high school. So Gotcha. We may be on the sidelines. You may see me on the sidelines at College Park, at Frassati. You'll see some of my partners on the sidelines at John Cooper and the Woodlands Christian Academy. But in terms of that coverage, we also cover volleyball, basketball, golf, tennis, any athlete that has an injury from that high school level, and then also up to the collegiate level, and we even got to treat professional athletes.
Gotcha. So I'm hearing kind of a theme on that on the training side as you were taking that trajectory, and it sounds like it's moved on when you do that much football and volleyball, and I bet you're good at knees and shoulders.
I take care of lots of knees and shoulders. I also, so we do a lot of rotator cuff repairs, a lot of labral repairs, shoulder stabilizations, ACL reconstructions, multi-ligamentous knee injuries. So have a lot of that opportunity, and then also get to do some joint replacements and trauma call in the community with Memorial Hermann Hospital here in the Woodlands.
Gotcha. So into a number of things, before we get out of kind of the background time and
Sure.
talking about your journey to where you've been. Me still being new, I try to do a little background research, but then I'm talking to folks and I hear things, and legend has it that you paved the way for a Hall of Famer to become who he is today.
Yes, yeah. So I graduated high school from Westlake High School in 1997. In 1996, we won the Texas 5A state championship. I tried to carry the team on my shoulders, but our quarterback was Drew Brees. So
that little
he's
guy?
He's Drew and I are buddies. He's a good friend of mine. He's somebody who I talk with here and there, and we see each other. My kids, it's super funny, but my kids think every time we go to a football game that we're going to get to go onto the field, because every time we would go see Drew, he would get us passes to go
Sure.
onto the field at the Superdome. And so I go to the Texans. They're like, Dad, when do we go on the field? And I was like, not today, guys.
Not
We're
today.
headed home. We're headed home.
Well,
So,
see, that's what happens when they get spoiled young. But so, prior to San Antonio, I was in Austin for 12 years.
awesome.
And lived right in between Westlake and Lake Travis districts. And, there were a couple things that jumped out to me. One, when I moved there, and I grew up in California where football's a big deal.
Right.
But the first day I went to school with my son, and a parent told me, I've got Lake Travis Westlake tickets. You want to go? I went, that's high school, right?
Yep.
And they said yes. And I have tickets. Would you like to go? And I went, so we're getting advanced tickets for high school game. Okay, that's a big deal.
Yes.
But also realized that, guys come back home and happen to be walking into HEB one day, and I went, that guy looks like Drew Brees. As I got closer, I went, that guy is Drew Brees.
Oh, yes.
But saw him trotting around the community and having a good time. I did not run up and, bother him. I was like, he's got to get those eggs home.
Well, Drew's one of those great guys who what you see is what you get. Like
Sure.
he is very down to earth, very humble, very much a person that you want to have. I mean, I think if I picked up the phone to call him after we got done here, he probably would pick up and say, "Hey, how's it going?"
Yeah,
so,
that's awesome. That's awesome. And it's good to know that he became who he was, because never a blitzing linebacker touched his little soul.
That's right. That's
That's
right.
And you can remind him of that. Next
That's
time
right.
you say, remember that dude from, just fill in the blank school? He was coming down pretty hard.
That's right. So anytime you're going to send me a thank you card,
That's right.
I'm available.
That's
Absolutely.
awesome. That's awesome. So still with a full practice and,
Yes.
and doing all of the work that you mentioned. But then you've got PB&J. So tell us a little bit more about PB&J.
So PB&J, we started a little bit of personal branding, and as marketing has evolved and the community has evolved, I'm just a firm believer in being out there and getting out and getting out to the people. I want to be somebody who lifts people up and who serves the community, and I want to bring that to people. I mean, just making people smile, making people happy, seeing those patients who are recovering, getting better is amazing. Hearing people say, "Hey, I saw your video online," and they're smiling and laughing, and now it's gotten to the point, we go walk down the street, I see somebody at the grocery store, they're like, "Hey, PB&J," and I'm like, "Oh, thanks," or you see somebody at a lot of the nurses and OR staff and folks at Memorial Hermann at the surgery center, like they follow us on Instagram, and just the fact that it makes them brightens their day a little bit means that I'm doing what I want to do, which is make people happy, bring a little joy to the world, For sure.
And that's great, and it's certainly a great angle on it. And I would imagine, like many doctors in different specialties, it's not the best circumstances when people show up, right?
Right.
They have had an injury typically, or they've had a long-term issue, and they get to walk in and they get a smiling face. They know they have an expert, and it does, being that involved in the community, I would say that brings a certain level of comfort and ease in their spirit, and, they're like, it's going to be okay.
Right, and that's the beauty. I mean, we oftentimes in orthopedic surgery and emergency medicine, trauma, we see patients really on their worst day, right? And so that is, especially when you're on call, somebody's had a car accident, somebody's had a major injury from a football game or something, being able to be that person who can help get them through from the beginning really to the end and get them back to producing the way they were before is just, it's a huge blessing. And I mean, that's the beauty for me is, I'm just blessed to be here, really.
Absolutely. And the advancements that we've seen in your field, it used to be, you'd see a guy get injured in week 1, and they'd say, oh, he's done for the season.
Right.
And I don't know what magic you all are working, but, they go, you saw him get hurt today, and the doctor says he'll be out 2 weeks, or he'll be out 3 weeks. What are some of those things that you guys are doing new and innovative that's just like increasing? Is it just technology? I'm sure it's a wealth of knowledge that's been grown over the years.
Definitely, we've had a massive increase in knowledge. I think that we see just the multimodal approach, right? When you've got athletic trainers, I mean, we have amazing athletic trainers at the high schools and at the collegiate level here. We have amazing staff members in nursing, physical therapy that's here. You just have these teams of people who are coming together. And so now our high school level athletes that back in 1996 would have been done for the year or done for their career are coming back the next year, and they're running faster and throwing harder. Wow. and able to excel at their sport. And that's just, a beautiful thing for me, to get to see those kids and those young athletes be able to succeed in the way that they want to, because that's learning a lesson, right? That's learning a lesson in success. We fail and then we succeed, right?
Absolutely. And just to kind of recap, you guys are involved with each of the high schools in here. So what kind of, I know you mentioned Cooper and Woodlands Christian, Woodlands High School, College Park. Are those the primary four?
So the primary schools that I work with in the region are College Park, Forsadi Catholic High School, which is in the Spring area, Westfield High School, which is also in Spring, and then I have partners who have covered the Woodlands Christian Academy and John Cooper.
Gotcha.
So we work with all of those, but a lot of the times you see our physicians and the physicians in the community. We have a lot of great orthopedists here who are covering on the sidelines, who are helping to get patients access and getting athletes access to great, exceptional orthopedic care, which is awesome.
And that's I don't want to overstate it. I don't want to harp on it, but I think people should know that that's pretty incredible, that you have expertise like yours that has been practicing for many, many years, standing on the sideline of a high school football game.
It's true.
Being able to respond, in the moment with the athletic trainer, with those staff, so that from the moment it happens all the way through. And I think that it certainly has to improve care and rehabilitation and all of those things. I look at, we talk about those advancements. I see, I can remember guys being hurt and what would have been a cast or a brace for multiple weeks is now, 30 minutes and you're up walking in a day or less.
Right.
And that's.
And I think those advancements, they just keep coming as we keep staying on top of medicine. Now, the biology tends to be the biology. It's hard to influence biology when it comes to tendon healing, ligament healing, and we've got to give that the time it needs. But I think also some of the super ultra conservative things that are now things of the past in terms of really advancing and getting patients moving.
Absolutely. Well, I commend you all on the expertise and the ability, because there are still days, especially as I get older, that I do my best to kneel and I go, God, in the miraculous way that you've put these bodies together, why the knee that way?
It's true. It's true.
It really is just kind of an interesting joint that is like, shouldn't there be more?
Yeah. And that's, we've got that. That's the beauty also. So outside of sports medicine, I do take care of a lot of total joints, a lot of knee replacements, hip replacements, shoulder replacements, which is a big advancement in the recent past, or here just over the course of the last 15 to 20 years. And even when I was training, we'd tell folks your knee replacement's going to last you 10 to 15 years, maybe 20 years. And now we're seeing data that's showing these knee replacements lasting 30 and 40 years. And so giving patients back pain-free functional lifestyle with a single surgery that we can get taken care of and not have to come back and do multiple revisions is really a huge advancement in medicine overall.
Huge. And so, not only are you all just looking out for the overall health or the joint health, it's really that quality of life, right?
Absolutely.
When you start talking knees and other joint replacements. I had a neighbor just before I moved from San Antonio. He was going in for hip surgery. Younger guy. He was in his mid-30s.
Wow.
And he was, his hip was pretty bad. And the day before his surgery, we kind of checked on him and said, hey, do you need anything? He says, no, I got family coming in there. They're going to take care of me and stuff. And I just happened to ask, I don't know why, I said, how long are you going to be down? He goes, well, I go in for surgery tomorrow at 6 a.m. They tell me I'll be done by 6 p.m. and I'll be home the next day and able to get up and walk. And I thought, that's incredible.
Yes.
And a complete hip replacement and not 2 days, and he's able to start that rehabilitation.
Yeah. And here at Memorial Hermann and multiple hospitals, I mean, I would say all of the major hospitals here in the community, We are now seeing total knee replacement patients, total hip replacement patients, up walking within 2 hours of surgery.
My goodness.
And I would say now we're getting close to maybe 90+% of patients because of the pain control we're getting from anesthesia, the surgical techniques we're using. 90+% of patients go home the same day. So they don't even have to spend the night in the hospital.
Wow.
And so same thing with shoulder replacements. Shoulder's a little bit easier to get home the same day because you can walk without and just have your arm in a sling.
Sure.
But the shoulder is a little bit more of a complex joint in terms of the rehab, but we definitely see huge, massive advancements, even since I trained, which feels like eons ago, but we would keep patients in the hospital for 3 to 5 days after these joint replacements, and now we're seeing patients go home in 5 to 6 hours.
That's incredible. That is incredible. Well, I mean, you talk about folks kind of noticing you on the street and saying, hey, it's the PB&J guy, and so Piefer Bone and Joint kind of taking off. You're working with patients from young, potentially middle school, high school, on up through their senior years. You guys are truly ingrained in the community in a fabric of, what keeps us healthy. I think a lot of times people just think, oh, that's just the guy I go and see when he gets hurt, but you guys are much more than that.
Right, and that's part of what I love to do. I love to be a part of the community. I feel like in the Woodlands, we are just immensely blessed, right?
Absolutely.
We have so many blessings, and we, especially with the chamber, the Woodland Sports Medicine Center, PB&J, all of us, like, serving people is what we're here for. And that's really, it's loving people, right? It's willing the good of that other person and getting them better. And that part I love so much about being here. That's why I love the people in the community. That's why I love the chamber, and that's why I love what I do. So
absolutely, that's phenomenal. It is interesting. After I got here, you start learning the dynamics of a community. And at one point I had to kind of stop and go, like, I don't remember, any question in my interview process or anything, but like, do you have to qualify to have a big heart to move to the Woodlands? When I saw, the way the community interfaces with each other, the way people take care of one another, and just that overall care.
right.
That if you're walking down the street and see a piece of trash, people pick it up.
Right.
Just walk by it. So from the little things like that up to just person to person, it is a community that really, really cares.
Yeah, and I had a relatively amazing experience here over the course of the last few months. There was a car accident, right? And somebody looked like they were pretty significantly injured. And as I pulled around to go step out to help, there were 20 more people who had stopped their cars to get out and to try to help and to try to render some aid and render service before EMS got there. And then obviously we had fire and EMS and police all show up. Obviously those guys take care of all of us, but just the community itself nobody was going to let somebody sit hurt waiting.
Absolutely. That's phenomenal. And so, with that, and I know that, Piefer Bone and Joint is what you all do. That's your career. That's the things you do. But you're involved in a lot of other things in the community as well. Share a little bit about that.
So, I mean, I try to set fashion trends with Amazon jackets.
Okay.
So these are, I love volunteering. I'm super active at St. Anthony of Padua, which is a Catholic church and school in the back of the Woodlands. I've worked with, we volunteered at the 4th of July parade, my sons and I. They're doing NCR, so I have a 16-year-old, a 15-year-old, and a 12-year-old.
Oh, my goodness.
Shout out to all you guys. They'll be embarrassed, and all their friends will send them messages. But
why don't we say their names? I think that's even better.
Cameron, hello. Cameron is driving, so watch out if you're on the road. He's 16. Caleb, 15, also has his permit. So Caleb's a cross-country runner trying to compete to win state. And then Caroline, my 12-year-old, right? She's 12 going on 25, so she can pretty much run the house.
And I was going to say, and the boss, right?
That's right. She is the boss. So, yes. So, hey to all you guys. And Chrissy is my wife, so we can't leave Chrissy out.
That's
She'll be equally as embarrassed to be brought up on the podcast.
That's awesome. Well, this is a family show. This is a community where we love one another, and so we cannot let you sit here and not mention the crew.
Well, and I wouldn't be where I am if it wasn't for them. Right.
Awesome.
I mean, I love my wife. I love my kids. I'm so proud of them. So proud that we're here and that we're getting to do what we do here. But I mean, the potential for them is so great. Like, I mean, I just tell them every day, like, you have a chance to change the world, right?
Sure.
We have a chance where we sit today to change the world.
Absolutely.
At 16, 15, 12, they can do it. Anybody else's kids out here can do it. Like, we just have such great blessings to have that ability to go out and make a difference and not only be leaders, but give and serve and love our community, which
Absolutely.
I think is awesome.
And as a great chamber professional, I will say all three of you, we know that you're going to do amazing things. You're going to go off to college. You're going to do big things. You're going to learn a lot. You're going to start businesses. You're going to run companies. You're going to do all those things. Come back home and do it.
Come back to the Woodlands.
We want that business right here in the Woodlands with people with big hearts and with tons of knowledge and that ability. You know, as I hear you talk about volunteerism, family, you know, the work side of things and putting all together. In each of those areas, you're a leader and you have to lead. But I hear you have a unique and you know, kind of breaking the mold with your leadership style. Tell us a little bit about that.
So, I mean, at PB&J, but also one of the things that I've really tried to emphasize for the OR, for the staff, for Memorial Hermann, for our orthopedic groups is really being collaborative, being humble, being grateful, acknowledging the people that are around you, right? The total knee replacement that I talked about that got to go home in 6 hours, right? That wasn't just me, right? There was an entire team from the OR staff, the pre-op and post-op, the physical therapists, everybody, the pharmacists who got them their medications, their own families, you know? And so I think leading from that, I'm leading a bit from behind, giving credit to the people that are around you, really acknowledging that. And when you talk about surgeons, sometimes that's not the first things that people think about, right? When they think about a surgeon, they don't think about humility necessarily. Those are not in those top 5 words of things. And I think that piece is a beautiful way to lead. And that's really what I'm trying to see, because we have high levels of expertise, but you don't have to be a dictator, right? You don't have to be a jerk. You can be loving, you can be kind, you can be humble, have great outcomes, and you can also still have tons of fun, right? Yeah. Because the reality is we get to have a blast. I mean, we get to do something that nobody else gets to do. We have patients. I mean, if you just sit and you reflect a little bit, right, that a patient is trusting me to open up their body and fix something, right? That level of trust, we have to earn that, right? And when we earn it, we also have to pay it back, right? We need to pay that forward to the patients so that we can give them everything we've got. And so I just don't take that lightly. And I don't think surgeons in general take it lightly. But if you just looked with a broad stroke across leadership and surgical leadership not in our community, but surgical leadership across the board, those attributes of being humble and being grateful and incorporating the team, having those folks, whether it's the equipment rep or whether it's your the scrub nurse or scrub tech, say, hey, what do you think, right? You know, if you have something that you think or that you see or there's some issue that you think we could do to make this better, let's talk about it, right? I mean, as long as your goal is to do the best for this patient who's on the table with us right now, then I'm open for all of that. So
it's phenomenal and incredible leadership. I think, you know, starting with humility, which is one that you're correct. I mean, you know better than I do, but that's not one that you think of right off the bat with most surgeons. But I think the other side is that it leads to, it sounds and it comes across so clearly, as an added level of empathy and care for your patients, which all of us can appreciate, right?
Absolutely.
It's we're not sitting in the exam room, but I can almost picture right now some of the conversations and that care that you take with people, and you know, not only growing their comfortable, let them know it's going to be okay.
Right. And there's that. I think there's that appreciation, like for folks who are thinking, like, man, my knee hurts like crazy. I'm ready to get. What do I need to do? How do I make this better? And they've Googled and they've searched and they've seen things, and the last thing they need to do is walk into a surgeon's office, get seen for 5 minutes and told they need their knee replaced, right? And so my spiel is almost always very similar, like, you're the captain of the ship, right? If we can change our nutrition, we can work on our diet, we can change to low impact activities, we can do injections, we can do a lot of different things. And when you get to that point in life, this joint is dominating your life and it's keeping you from doing the things you want to do, going out to dinner, spending time with your kids. Sure. Well, then now you get to tell me when it's time to have the joint replaced. And that's a much more satisfied patient at the end of the day. And it takes more time, but it also is the way that I'd want somebody to approach me.
Absolutely. So I have to ask, because I know you're a wealth of knowledge, you have a ton of expertise. How much more challenging has your job become because of Google and WebMD?
It's a challenge, but it's not an unwelcome challenge, okay. Right? I think that people come in and we know sort of where they're coming from and what they're seeing. I think you do have to be careful a little bit because you can find a lot of misinformation about these different options, whether it's super high level cash only type treatments like come get this and we're going to make you cured, or they have a little bit of those different things we work our way through. I think it was a little bit more frustrating 5 years ago. Now I think things are getting better. I think with AI and with some of these new, like, hey, ChatGPT can answer all my questions. It's going to be interesting to see how those conversations continue to go. But I think that piece, having informed patients is not a bad thing. Right. So I think that's good. Has it made for a little bit longer visits? Absolutely. Okay. But again, like we have to adjust with those times, right? Yeah. Because patients oftentimes are not coming in telling us what to do. They're coming in saying, hey, this is what I read. Gotcha. Can you tell me if this is the right thing or not? Like, I want to do this. Like, I'm 25 and I think I need my knee replaced. And it's like, maybe that's not the best choice. Yeah. Maybe we should do something different.
Yeah, you can slow that down a little bit.
Or I need to get my shoulder replaced, but I also still want to go, rock climbing every week, and it's like, well, we may need to back off on that so that we can do the right things to keep you where you need to be. So I think it's been good. I mean, all of the Google, everything we're advancing at a pace that's just amazing right now.
True. Yeah, it's funny, and I ask that question just, in everyday conversations, and I know a few folks who I kind of feel sorry for their doctors because I feel like they walk in and the doctor has to undiagnose them to diagnose because they've done so much, and it's never the easy thing. Like, they do the WebMD thing, it never comes out that they have like a cold,
right?
Or when it's a joint issue, it's not, you just need to not bang it on the cabinet. It's like, oh no, I've got a torn this and I pulled that and I need to have it all replaced. And so
and the advantage we have over that electronic media is that we get to see them in person. We get to lay hands on the patient. We get to feel if those ligaments are really working or not. And oftentimes it's really an opportunity, right? We get to tell them, hey, the cancer that you think you have in your knee is not really anything, right? Or that major problem that you think this is much more likely a minor problem, or we're going to find that out with the X-ray or the MRI,
for sure, and
we'll have you an answer before you get out of here.
Excellent. Well, one of the reasons that you're here beyond just being an exceptional doctor is that you are a signature member with the chamber, and that's important to us. We really appreciate it that you all would invest in the mission of advancing the business community in our community, and keeping us all together. But why is it important to you to support the chamber?
I think as I looked and have become more ingrained in this community, really over the course of the last 15 years, I just feel like it's an important piece. It's an important piece to have like-minded business owners who are trying to advance and serve others, who are trying to lift people up. And when you make those networking connections, when you make those get out to volunteer, and you're giving and we're raising money at different events in the community, and you're seeing the same folks who are here and serving on the chamber, who are doing these things, those pieces make it just an invaluable relationship that I get to establish with people. And you never know who that person is that you're going to meet that's going to help change things for you or for somebody else for the better. So awesome. I think it's just, I love the mission, and I in reality, I love this community. I love being in the Woodlands, and I love the people here. And that's, it's just, like I said, it's just a huge blessing.
Absolutely, absolutely. Well, we certainly thank you for all that you do, and it's been fascinating learning a lot about your story and your background. I'd love to sit here. We could go for an hour and just have
I
you
agree.
tell stories and all of those. So I know you can't disclose names or anything like that, but we'll start the wrap up with kind of what's been your most interesting case, or what thing are you most proud of that you've done in your practice?
So, I mean, they're across the board. So we do a lot of surgery.
Sure.
And so, but getting in and taking a patient from that spot, from the field, right, from on that football field where they've had an injury, and we can tell them usually within a few minutes, hey, this looks like this is going to be an ACL injury, and we get them into the office. We see them. We see them on Friday night. We get them in. We get them taken care of. We've got an MRI. Now we're already into physical therapy. We're working with the athletic trainers. And then that moment when you get to see them back, that final time when you're at 9 months out, 10 months out, 12 months out, wherever they are when it's time to get back and get going. And that moment, like there's that special moment between the physician and his patient. And my work is in the beginning.
Sure.
All the rest of the work is on them. And these are teenagers,
Yeah.
for the most part, right? 15 to 25-year-olds for the most part who are dealing with these injuries. But then they're back and they're getting to play soccer and get to play football and getting to do things. And you get that moment with patients who you've replaced their shoulder, right? They couldn't lift their arm up past here.
Sure.
And now they're up, and they didn't want to pitch for the Astros, but they wanted to be able to comb their hair, right? And they wanted to be able to get their wallet in their back pocket. And to have those moments when people are just so grateful that it just is overflowing. Like you can't help but just be joyful in those moments with people who've had great outcomes. And that I love.
That is phenomenal. Well, thank you again so much for being here with us. To each one of you, I say, compassion, leadership, empathy, and expertise. Piefer Bone and Joint. And Dr. Piefer, we really appreciate you stopping by today. It's great to learn about you, great to get to know you a little bit more, and to share your story with everyone that's viewing. So thanks again.
Absolutely. Thank you so much.
Thanks to all of you for tuning in today for Between the Trees, presented by Woodlands Online, a video podcast of the Woodlands Area Chamber. I'm Aaron Cox, your president and CEO and host. We again thank Dr. Jason Piefer of Piefer Bone and Joint, and we will see you next time on Between the Trees. Have a great rest of your day and week.
Thank you.